Laser eye surgery has become a popular and much needed surgery for any professional athlete looking to stay atop their game.
Quite frequently athletes come in to have laser correction done. Not necessarily just athletes, but people who are in athletic roles. So, someone might consider themselves an athlete, but baseball players, hockey players, the number one thing that you read on intake forms is, well, I want to get rid of my glasses, but on further probing often it's golfers. Golfers probably the number one. And when you think of it, that's normal. You've got a very small object, you got this 42mm ball that you have to see 150, 200 yards away. So it's very visually ambitious. It's something that's tough to do. So you need a good level of vision to do that.
From improved vision of fairways in the tee box to clearer views of the putting green, it's a proven fact laser eye surgery will make the game easier on your eyes. Just ask Mike Weir.
It helped a lot. I mean, shoot, I was, 2375 vision. I had very, very poor vision. So when I had it done, it's been, let's say, 13 years ago now, and I have never had a touch-up. It's not quite as good as what it used to be when I first had it done, but it was just a significant difference when, from wearing contacts and having bad allergies and having to put contacts in, and the irritation you have, and in different conditions, different places you play when it's dry, or wearing glasses. I think that depth perception was a little off sometimes. I noticed a big difference in green reading when I initially had it done. Now I'm used to it, so I don't really notice it. But I remember when I first had it done and seeing the greens and seeing different contours, it was a big help for reading greens.
Although having the surgery may sound daunting, the process is actually quite simple and takes very little time.
So initially when the procedure is done, you're going to have your eyes frozen. A lot of people are really concerned that there are needles involved, and there are no needles. Freezing is done with drops. You're going to go into the laser suite. We lay down, and you'll be in a LASIK, for a LASIK procedure. The first step is flap creation. There'll be an eyelid holder that's put into the eye. People's concern is often, well, what if I blink? Well, we can't blink because there's an eyelid holder there. A little suction ring is applied to the eye, and as the name implies, it makes the cornea adhere to it, so now you can't move your eye, which is often a concern for patients as well. A laser creates a very fine flap. It's usually about a tenth of a millimeter thick flap. It takes about 20 to 30 seconds to do that. We lift that flap up. Then there actually prescription is applied to the surface of the eye with a laser, and it's a computerized profile which not only will address your nearsightedness, your astigmatism, but also any little elevations or imperfections that are on the eye as well. So the laser time can range anywhere from, on a low prescription, it can be as low as 15 seconds, to a very high prescription, it can be around 60 seconds. We replace that flap, we give you some antibiotic drops, some anti-inflammatory drops. We smooth the flap out, and to do one eye takes probably about 7 minutes from start to finish.
The list of golfers and pro athletes who've gone through the laser treatment include Bernard Longer, Aaron Baddeley, and Woody Austin.
Glasses, of course, have limitations, so people move up to contact lenses. They have limitations, so then they move up to laser. But effectively, in terms of performance of the sport, it improves your distance vision. So you're going to see the pin better. You're going to see how far things are. Club selection. Should I use a 3 or a 5 iron? If you don't see how far away something is, it's going to be more difficult to do that. Depth perception. So when you're on a green, you're going to see the breaks and slopes differently. Tiger Woods used to say that after he had his eyes lasered, he could actually accentuate the breaks and see the slopes in the green actually better. Tom Lehman had commented that he could actually have better direction on how far the pin is, the yardage on the pin. Again, you got a good grip, you got a good stance, you got a good backswing and so forth. But if you're not able to make good contact with that ball, if that hand-eye coordination is not right, then there's going to be an effect on that as well.